Hi, everybody. Indonesia is a very interesting place right now. We have a new president, Joko Widodo, who has a very strong vision for kind of trying to empower and build Indonesia from the periphery. But at the same time, you have a lot of pressure to deliver, to reduce poverty, to accelerate the gains in poverty reduction, reduce inequality, and also close the gap in access of basic services. So it's an interesting tension between trying to empower, but at the same time, you're trying to hold accountability for better, faster results in terms of service delivery. So this is the context in which we, in the National Development Planning Ministry, have been trying to develop a new strategy, which we call the frontline strategy for improving basic services for the poor and vulnerable. So the frontline strategy is part of a 4-pillar plan for reducing poverty and inequalities. It focuses on improving basic services among the 40% poorest population. And when I speak about basic services, there's a package of services from health, education, legal identity, also protection, and also basic infrastructure, so things like water, sanitation, and housing. So this strategy is already part of the National Development Planning, medium-term National Development Plan for 2015 to 2019. And now we are at this stage of trying to figure out how to implement it, how to make it happen, and then start a pilot in 2016. So how is this frontline strategy trying to implement or adapt the DDD principles? I think, first of all, we started we zoomed in the policy intervention and the analysis at the front line. So this is looking at the frontline facilities like health centers, schools, and also sub-district administration centers. We took a team that is comprised of different sectors, a multidisciplinary team from 8 different directorates to actually connect with the realities on the ground. And we didn't just sit at the table. We visited the facilities. We visited households and communities. And it was a very enriching experience from a number of perspectives. One is that, of course, we got to engage with all the different stakeholders, from the service providers, the households themselves, local officials, and CSOs. But it was also a very rare opportunity that we, as a multidisciplinary team, got to look at the same problem, but from very different angles. So you have a health education specialists who are looking at it from a system strengthening perspective. You have governance and decentralization experts. Then you have water sanitation engineers. So it was a very interesting and very enriching interactions we had. So at the once the assessments were finished, we undertook a number of consultative workshops and thinking processes, and we came up with a very simple model, a very simple framework to move the work forward, and we call it the sandwich model. So it's basically a coupling of top-down interventions on how to strengthen local governments, and we couple that with bottom-up community empowerment, social accountability initiatives. So the idea is to have a responsive government that can adequately respond to the needs of its people in terms of providing services. And then you have citizens, communities who know about their rights, who know how to access them, and they can be a part of the service delivery and be a part of monitoring and providing feedback for the services. So secondly, what we try to do is make the local government and the local actors kind of the driving force for the reform. So we have a second phase of decentralization happening. And when I say local government, I'm referring really to the district level and below. So we have in Indonesia central government, province, district, sub-district, village. But the ecosystem of change that we're looking at is the district level and below. and the actors within that. You have the local officials, you have the local leaders, you have the CSOs, you have citizens, and you have service providers. And in this paradigm, the central government kind of takes a back seat. We don't do so much the directive or prescriptive role, but we are more of a facilitation role. We have to learn how to be more of a facilitator rather than telling the district governments what to do. So the point is that we try to provide the supporting policy environment so that districts can identify their own problems and can solve them on their own. And third, we put an emphasis on innovation as the fuel for the reform. And here I want to highlight that we are not trying to create a new program. There is always that tendency or that temptation that once you struggle with progress, you want to create a new program. But here we are not. What we're trying to do is work within the system and create the space for piloting experimentation at the lowest level of government possible. And as I mentioned to you before, we're envisioning or trying to plan for a pilot to start in 2016. We are still thinking it through a lot, but the main idea is how do we create multidisciplinary teams at the sub-district level, at that lowest level, to problem solve together. So some of the things we are looking at include flexible financing at that level that are not tied to all the sector plans and budgets that are determined at central level. We're looking into how do we build the leadership and change management capacity of the sub-district officials. We're looking into also the incentive mechanisms for the district government, but also for the service providers, the civil servants, and looking into diagnostic tools. How do we use innovative data tools to have more rapid feedback and analysis? And I would say that some of the challenges we face, one is that we are engaging a very broad set of actors on a very broad set of issues, from legal identity all the way to water and sanitation. And to get this huge group of people to start to think differently is quite a big and challenging task. And there's always the pushback of, oh, everything's fine, why do we have to change? And then there's also the challenge of trying to translate a new way of doing things into the matrices, Excel sheets that show all the different activities that the government has to plan and budget. So the frontline is a new approach, but putting that into the little boxes, into the planning work plans and budgets is a huge challenge. But I think we have some opportunities. One is that there is a growing coalition of people who are trying to be reformers within the government, but also across the development partners, especially DFAT. And also I think we're not working in a vacuum or in an absence of innovation. There are already things bubbling up from the ground. There are already reform-minded individuals and district leaders. So it's more building on those already existing energies, and how do we demonstrate doing things differently at the ground level and leverage use that to leverage more broader reforms at the national level. Thank you.
Thank you very much.
Yeah.